So I was born in Akron, Ohio, which is sort of the heart of the Midwest, rubber capital of the world, a city that made its metal based on the Industrial Revolution in this country, and a great place to be brought up. I was brought up in the 50s, and it was after World War II. Everybody was focused on building a life and really investing in their future. I was very much influenced by somebody like John Kennedy when he became president. I was 12 years old, and I was inspired by his forward thinking. It's when the space program started. I mean, the United States was really on a big upswing. I remember the day, and as I'm sure many of those of you that were there, President Kennedy was assassinated. His brother was assassinated. Martin Luther King was assassinated. We had uprisings over many things that led to riots in the inner cities, particularly of Detroit, Cleveland, Akron, where I grew up. And that took us toward the end of the 60s when the re-examination of our values occurred, is the way I would put it. I can remember as a 12-year-old kid reading the writings of Albert Schweitzer and thinking how important that was to help others. So that's kind of the story of the 50s and 60s. Well, Woodstock was a very interesting phenomenon. They planned for about 250,000, I think, coming, and they got about 450,000. So there were immediately problems, not enough water, not enough food, etc. But as an event, it is memorable for many reasons. One, certainly the music and the community, but in fact, all those people got along pretty much. I mean, there were some people that were had used too many drugs, etc. But in general, there was not violence. There was not there was sharing, and so it became an event that almost became bigger than just a rock concert. And I think that's why people talk about it even today, almost 60 years later. We started to think much differently about what the priorities should be. And I was caught up in that as well. I grew my hair long. I listened to what people had to say. I didn't really check out. I still decided to stick with going to college. But it really opened me up and enlightened me to a lot of the issues around me. Going to a liberal arts college, and Amherst is a great liberal arts college, was really very important to me because it during my freshman year, we had a wonderful course called Problems of Inquiry, where we were exposed to thinking for ourselves and starting to generate ideas and defend them. And that really drove me in the direction of wanting to write. Well, I went to school in Cleveland at Case Western Reserve, and we, again, were introduced to patient care our first year and taught to really think about what we wanted to do in addition to all the typical things you do in medical school. And so when I started my third year, I really enjoyed all of my rotations. I enjoyed pediatrics, I enjoyed internal medicine, I enjoyed surgery, I enjoyed psychiatry. I ultimately decided that surgery was for me, mostly because it was dynamic. You had to think on your feet a lot. It was very action-oriented, and that just appealed to my personality. And the surgeons seemed to have the most fun. To me, the essence of what we do to care for patients is to improve their lot, and research does that better than anything. It's difficult. It requires a discipline. It's best in planning a career for it to anticipate that you want to do it, so you get some formal training in it, which I did. So that's a very, very important lesson, particularly for young people, not to dissuade them at all, but just to emphasize the importance of a clinical trial. And that's true in oncology. It's true in every field of science. And until you really subject humans to a clinical trial, you don't know if your excitement in basic science is going to work out. VUCA is VUCA, so it's just an acronym for a situation where there is volatility, uncertainty. The C is for complexity, and the A is for ambiguity. So if you think about a war, you're on the battlefield, and that pretty well describes the leadership dilemma you can be in. Well, trauma is very good training for leadership in that regard. I'm very proud to have been involved in the movement in trauma, but also have many, many peers that have followed a very similar path where they've gone into leadership of their institution or their medical colleagues or at a national level. And a lot of it is because of the basic thinking that you are put into in dealing with a sick trauma patient. But I was very happy. I was helping to build a department, had an active research program and teaching program. I was very happy. I could have been very happy there for the rest of my career at Irvine. Some people that had worked with me on things reached out and asked me to look at the job for executive director. I also had thoughts about how we should transform education and our political advocacy agenda, and you know, a lot of thoughts. So when I looked at the job and participated, I was happy. I was in a good position to look at a job. So I told people what I really thought should be done, and it was I don't think it was aggressive, but it was deliberate. I had been a leader before and had tried that just by talking and trying direct influence. I'd also studied what organizations like Disney or Nordstrom had done to transform themselves into something that we all point to and say, I want to be like that company. And I did a lot of reading. And if you look at some of the best studies that were done describing best practice in industry, they're based on science, really, or social science, where somebody studies what's effective and then writes it up. GE has 25% of their 250,000 person workforce working on organizational management. I mean, a lot of people don't know that. They make toasters, they make jet engines, but 25% of the employees at GE work on organizational management. And it turns out that the center of that is in Wisconsin, just up the road from Chicago. So we brought them in. They worked with us for almost a year and a half. We identified about 250 projects we completed in the first 3 years, about 200 of those. And many of those things helped transform and increase the efficiencies of our programs in the college and allowed us to grow. Just before I took over, the college had engaged somebody to help look at how we were viewed. We were working on our advocacy efforts. We wanted to perform better, and we said, what do you think about surgeons? And it was not necessarily the most complimentary thing to hear. But I listened, because I thought, if we're going to transform something, we're going to have to start with the truth. And what was said is, we are viewed by the public and by Congress, etc., as The fighter pilots of medicine, very professional. We work very hard. We're not the easiest people to get along with. And oh, by the way, we drive the biggest cars in the neighborhood. So, okay, what do you do with something like that? And one of the ways, the best ways to do that is to replace the reputation with something that people think about when they think of you that doesn't necessarily change the negative, but it preempts the negative by emphasizing the positive. So as we thought about that, and I actually spent a lot of time working with Nancy Longley at the time and her team, we thought, what is it that we can demonstrate to the public and to Congress that we do that nobody else does? And looking out for quality, inspiring others to be focused on quality is where the Inspiring Quality campaign came from. And then we ran it. We weren't sure if it was going to work. We put a fair amount of money into events all over the country, etc. And when I knew it was working, I went to a meeting where my peers, other leaders of other organizations, including the AMA, we had a meeting to talk about some issue at the airport in Chicago. And when I walked in, the leaders of the AMA came up to me and said, "What's all this quality stuff you guys are doing?" And I knew, okay, we're getting people's attention. So that's where it started. And it was not necessarily a bad thing, but we wanted to reshape our reputation into a much more positive thing. And I think surgeons deserve that. Well, you know, an organization, particularly one that's got the legacy that the college has and that's 100 years old, has got to refresh itself every once in a while. You know, about 3 years ago, we re-looked at the icon and changed that, and it was very, there was a lot of concern, you know, but you also have to listen to particularly the young members and find things that resonate with them, since the organization is now theirs. I've never met a surgeon that I didn't believe really cared for their patients and cared for doing the best they absolutely could for their patients. And they know that the discipline that they learn as a resident and the discipline that they practice every time they go into the operating room is what gets them there. And so, you know, we just need to remember that's what we're all about. That's our responsibility to patients. When COVID hit, as you recall, there was a lot of second guessing. Is this real? Is it not? So we had time to sort of think through when we had to isolate. That was really handed down. There were plenty of employees that would have been fine coming to work. When I thought about myself, though, it really did not make sense to go sit at home when my home was walking distance to our building. I had the technology there. I had the resources in the building. So that's why initially I stayed there. I lived actually in one of the hotel rooms in our building for several months, and then it just made it, quite frankly, a lot easier. But I think, you know, just going back to the concept of a VUCA moment, when you face something like that, leaders have to be in charge. It's not. I didn't look at it as a sacrifice at all. In fact, I looked at it as my responsibility to help lead us through this. The only problem I really had was food, because a lot of the restaurants started decreasing, but then they came back and started delivering, so that all worked out too. You know, I remember when I was much younger thinking about family, etc., and knowing that I was a pretty driven person and was going to be a surgeon and have that kind of career as a trauma surgeon. I don't know whether you attract people that are like you, or you actively look for that. You know, when I met Beth, my wife, she's a very independent person. You know, you concern, you make it up to them at times when you can, and we've been very successful. We're blessed with 2 great grandchildren that are same. We're trying to figure out how to spend more time with them, just to, you know, fill their lives but not get in the way. So it's a balancing act. There's nothing more fulfilling and inspiring than helping somebody get through a disease and operate on them and work with their family, etc. You know, enjoying that is, to me, a key to your own self-success, and that's leadership principle number 1. Be true to yourself. The second, for broader sort of leadership, when you're leading an organization or people or a division or whatever, you have to have some clarity in your mind, or what people like to call a vision of what you want to do. You can always change it. You can change it on the fly, but it's important to go at it with at least a plan, and then you know, adapt as you need to. So you know, people will follow you if you have a vision that's at least reasonable, and you can communicate that. So you've got to communicate, and you've got to feel comfortable talking to people and walking up to them and sticking out your hand and shaking their hand if you've never met them. I mean, just simple things that you learn as a child. But the big deal part of it is in your own head, and it's whether you really believe in yourself and also want to help others.